Hi, I'm Dr. Kristen Jacobs. I know you cannot tell because I look more like Darth Vader, but we are in a treatment room, so we wanted to show you a couple of different things that we are doing right now. And I want to introduce you to Carly.
Hi.
And again, you can't even see what she looks like either. But Carly is our new nurse practitioner, and we are so excited to have her. I tell all my patients she's the smartest nurse practitioner on earth because she spent 2.5 months just doing webinars and education and one-on-one Zoom calls with me and the nurses and all of the support staff. So she, I think, knows everything there is to know about every treatment here at Ooh La La, right?
Yes.
So what she's doing right now is our Laser Genesis, and our beautiful little model here is my baby son, Michael. Say hi, Michael.
He can't see anything right now.
So Mikey has a little bit of acne on his forehead and a little bit on his chin. And we had it all cleared up before all of the COVID mess, but as with everything else, we all kind of fell off the wagon, and he fell off the wagon doing all of his skincare at home. But in the end, it really doesn't look that bad. It just has spots. So if I can get him in here and do Laser Genesis and then a DiamondGlow right afterwards, this will clear up in a couple of weeks. In fact, it'll probably look a lot better after today. So like I said, Carly's doing the Laser Genesis, so I'm going to let you explain what the Laser Genesis is.
Sure. So on Mikey, we are treating him for acne. So it is drying up any bacteria that's on the skin. It's actually killing the bacteria. It's shrinking his pores. It's helping with texture and tone. But of course, it is kind of like our duct tape procedure, so meaning it treats a lot of different things.
It does.
So it can stimulate collagen for fine lines and wrinkles. It helps with underlying redness, hyperpigmentation, brown spots. So it's just an awesome procedure.
How does the treatment feel, Mikey?
It's kind of warm, like a hairdryer, I guess.
Yeah. I'm going to have you just
And you
turn
can
to the
see
right.
how he is a little bit pink. I think you can see that, how he's just a little bit pinker on this side than he is on this side.
Right.
And it'll be interesting to see after we treat the little areas there, that actually should lighten up just a little bit. It's pretty amazing how fast this can work. And then go ahead.
No, I was just going to say, and it's recommended for a series of treatments.
Right.
So approximately 6 every 2 to 4 weeks, and then of course a maintenance of every 8 weeks or so.
Perfect. And when it comes to acne, you actually can come in weekly to do them if you want to, or you do Laser Genesis, then DiamondGlow. Or, I mean, if you really want to hit it hard, I mean, obviously the more you do, the faster it's going to improve.
Right.
Now, we talked about products, and we talked about how he fell off the wagon just a little bit. And again, understandable, we all have we all have issues sometimes, but what we have him on is several different things, actually. He has an Aha Baha cleanser, which has a little glycolic acid, and he's supposed to use that 2-3 times a week. People who are more acne prone are a little more oily, and they actually should be able to use the Aha Baha cleanser daily if they can tolerate it, but it's indicated for 2 to 3 days a week for anybody, and then we bump it up if we need it for acne. And what that's doing is exfoliating the skin, and it's giving you a nice clean palette basically for any of the products you're going to put on. He also uses our facial cleanser, and so when he's not using the Aha Baha cleanser, he'll have the facial cleanser. One of the tricks that I learned with washing my face in the evening is using our hydrating wipes from Color Science, which I know you've heard me talk about a million times if you've seen any of my videos at all. But I actually gave him a pack of the Color Science wipes. Have you used them yet, the Color Science wipes, Mikey? Yeah. Do you find that's just a little bit easier to wash your face?
Yeah.
So good. And are you using them in the morning or the evening or both, or more in the evening? Okay. So I think it's so important to wash your face at night, and obviously he's not wearing any makeup, but we do wear sunscreen when he's outside, so he does still need to wash his face. So those are the cleansing products that he uses. Then I meant to look in the bathroom this morning before I left to see exactly what we have. But did you look before you came in? So what are you using?
The retinol.
And I'm sorry. For 1 second, come look at his forehead and how much
it's pinker
pink. It's pinked up, but also the redness of the actual acne I think is improved.
Yes.
It looks really good. So okay, sorry. So you're using
The retinol, recalibrate, and I can't think of it.
oh, you're using the TNS Recovery Complex. Yes. So because his acne was a little bit worse, it was probably 6 months ago. I actually got him some TNS Recovery Complex, which is our growth factors. One, because I didn't want any scarring to occur, so he was using that mainly over the acneic areas on his forehead. What the growth factors do is they stimulate collagen. So, you know, he's young, he doesn't necessarily need the collagen stimulation, but again, I'm trying to keep any kind of scarring from occurring. And so the TNS recovery helps to heal the skin. It helps to create again, healthy palate. And that's what we're trying to do. The other product that he mentioned is the retinol. If you've heard of, you know, Retin-A, tretinoin, those kinds of products that we use for anti-aging, but we also use them in acne, and they're outstanding. And you actually, let's say he just had one little spot. He really could just use the retinol in that one little spot. We use our Skin Medica retinols because they are a little bit better tolerated than a prescription. And they actually, the studies show that they're just as efficacious as the prescription ones. So when we do a study head-to-head on the retinol, our retinol 0.5 and a prescription tretinoin or something like that 0.5, they're the same strength and they do the same thing for the skin. The difference with ours is that the retinol is actually encapsulated and it goes down into the dermis, which is where we want it. We don't want it to stay on top of the skin. We want it to go down there, and then the capsule fades away, and then the product actually works down in the area it's supposed to. The prescription ones can stay on top of the skin, create some redness, create some dryness, and people will stop using it because they don't love it. Can you see him? Okay, sorry, I know I'm talking, but I just want to make sure we're showing that just as much. But anyway, so the retinol is important for anti-aging, but it's also important for anybody who has acneic skin. Now, he mentioned Recalibrate, which is actually our man product, and really in the beginning it was very helpful for acneic patients. And so we happen to have some of the, again, man products in, so I thought, well, let's take it home and let's see how it works. So I'm throwing a lot at him, and I probably have photos from way back in the day where he was not taking care of his skin at all, and even though it's a little rough today, it's not nearly as bad as what it was. Now imagine being one of my children and having acne, and I must give them a terrible complex because on a almost daily basis, are you using your product? Are you using your product? Are you using product? So imagine me as your aesthetic physician and living with you and asking you every day, did you put your morning product on? Did you put your PM product on? Did you put your sunscreen on? And this is what my whole family lives with. So the good news is that he probably will never have a wrinkle in his life because he's using all the right products right now. And as Carly mentioned, the Laser Genesis is excellent for anti-aging, but also helps to shrink the pore size, get rid of the bacteria, and helps with so many other things. I love how she called it the duct tape of the clinic, because really, if we are not sure, like, oh well, let's try this, if we're just something new that we're seeing or whatever, we'll say let's try Laser Genesis. Yeah. And it really is a pretty amazing procedure. And is it your favorite? Okay.
It's my most favorite.
And it's funny because I don't get it done nearly enough, but as I don't get a whole lot done. I love the DiamondGlow, so I do make sure that we're getting that, or I get that. So I need to get here and do some Laser Genesis as well. And like I said, like she said, with acne, you can do weekly, but eventually, hopefully the acne is clearing up, and then you can spread it out a little bit more.
And you can treat other areas of the body
Yes,
as well.
yes. So actually, it is great for scars.
Yes.
The scars need to be a little bit more healed. You can't have a fresh scar, but it helps with that. And trying to think what else. Stretch marks, you could use it for that. I like microneedling better for stretch marks, but you could use it for that. So
Yes. Yeah.
Big pores, it'll shrink
Right.
the big pores.
It'll-
That's why I loved it so much.
yes. And we love this as an add-on. So if like are you all done?
Yeah.
Okay, perfect. How many pulses
We
did you
got
get?
about almost
Yeah.
3,500.
See, I torture him and make him do 5,000.
Do you want me to?
No, that's okay. 'Cause I wanna
Is that
say-
okay, Mikey?
Again, I mean, there are benefits to being my child, right?
Right.
He might not see it, but there are definitely benefits. But so we're going to move on now to DiamondGlow, which is what I had last week. If you watched the show, but
Yes.
what we're going to use it for him. Oh, good.
Yeah,
Don't have to
there
yell so
you
loud.
go.
What we're going to use it for him is obviously for acne treatment. So you're going to use which?
The pore clarifying.
Okay. and-
So go ahead.
Oh, I was going to say you may do a little hydrating too, but let's start with the pore clarifying and
Sure.
see. When patients with acne are a lot of times very dry, and they need some hydration along with it. So doing a mix between the pore clarifying and the hydrating might be a good option. And that's the beauty of the DiamondGlow is that we can do so many different serums along with it, and we can treat different things. So we have the brightening, we have the vitamin C. I'm cheating on looking at my little
You're
drawer
fine.
here. And
Ultra
the ultra
hydrating.
hydrating and the pore cleansing. And then there's a new one coming out that is going to go along with our new TNS A+, which, by the way, we got in stock today.
Yay.
So I started unloading some of the boxes just to get a display going, and then we are ready to get that into your hands. And the TNS A+, speaking of acne patients, normally, like our TNS Essential Serum, we don't recommend acneic patients to use, but the TNS A+ actually can be used in any type of skin. So if you are acne prone, if you're sensitive skin, if you're dry skin, if you're just worried about anti-aging, this is the product for you. And I cannot tell you the excitement that we've had since we've been talking about it. And I mean, people are like, give it to me now, give it to me now. So we are super excited to have this product in. I'm not sure I'm going to be sharing that one with Mikey or my other son, Jack, but I will share it with hubby, Rob. So he'll be getting one as soon as we get our staff ones in. So how did that Laser Genesis feel? Not too bad? Okay, was she better than me? Yeah.
Oh,
that's
thank
how
you,
it always-
Mikey. Thank you.
That's how it always is. He likes the other providers much better.
Aw.
But I get to bring him up here on the weekends and get the treatments done. So that's why I say
Let's take
usually
these off of you so we
you're
can see you.
around 3,000-ish pulses, but I always make them do 5,000 because I'm just getting them on the table is hard enough to do because they're so busy. So yeah, I mean, I really do think it's improved.
Good.
Don't you-
Yeah.
don't you
Yes.
think? I
Yes.
mean-
Just from
Not
when.
as swollen and these
Yeah,
Right.
It's not
and
as
it's
red.
like drying.
Yeah,
That's why it's
I'm gonna start on your neck, okay?
right, because it definitely gives you some immediate relief there.
Right.
And so now we're doing the DiamondGlow.
And so we start with the neck, and we do one pass on the neck, and then we'll move up to the face. And I just have a sensitive grit for Mikey, but we can customize to whatever skin texture or tone the patient has as far as what diamond grit we use.
So how does that feel, Mikey?
Similar to the hydrofacial.
Yeah, so like
Okay.
suction.
Yeah.
Doesn't hurt though, right?
No.
So there's really no downtime with DiamondGlow. You can return back to your normal
Let me give you that in case
activities
you
after.
feel like you need. Right, there's no downtime at all. That's awesome. And then let's talk some of the other products that you use because we are big on sunscreen, and he probably doesn't even know the name of it, but the Total Protection Face Shield is one that we use, which is probably what we'll put on today. But also, what's the other one that you use more than anything?
The brush.
Yeah, so this unforgettable brush.
Love the brush.
So which again, she'll talk about it in a little bit, but the face shield is total protection. So that's protecting you against blue light, infrared, environmental issues. There's not a lot of color to it. So that's why the boys don't mind it. A lot of times when you're doing a physical block, it's zinc oxide and titanium dioxide, and it's more white. So this gives just a little bit of color, so when we're rubbing it in, it blends into the skin beautifully, so you don't see it on. Plus, it feels great, and it's very hydrating to the skin. It has a product called PhytoMoist, but it also is excellent for people who have acne, who are acne prone, because it's not oily and all the other bad stuff that come in, and chemicals, no chemicals in this.
It's the only thing I have on today.
Is it really? Do you have the glow or just the regular?
Just the regular.
Yeah.
I have glow on today, and just the glow.
Oh, isn't that so nice? You can
Yes.
just wear that. I don't
Yes.
think we have a glow in here. So what we're talking
love
about
the
is
glow.
this has two other colors actually. It has a bronze color, and then it has the glow. And what the glow does is just what it says. It makes your skin glow. I've been wearing that one to walk the dogs. I mean, that one has been, I really like it. And when I got in the, I walked the dogs yesterday, and then I did laps in the pool, and I just put the glow on. And I thought, after I did my laps, I thought, well, I wonder, because it's water resistant, but I wonder how much is actually going to come off on my cleansing cloth. And so when I got out, I should have taken a picture of it,
just like
but
that.
when I got out of the pool, I used the cleansing cloth, and it was almost as dark as my even up, which tells me that the glow stayed on while I was in the pool and doing laps, so my face was down in the pool.
Wow.
So I know,
That is-
I was pretty impressed. I'll
That is
do
impressive.
that at the poolside one day so that we can show that. But I was really impressed by that because, you don't really test it in those kinds of ways, but it was definitely as dark as my even up. But anyway, then the other product is that this is what they use pretty religiously and would prefer to use this all over their body instead of using any kind of liquid. And so it's the powder sunscreen. Let's see if you can see this one, because it's we use it as a tester, so hold on a second.
And that one comes in different colors
It
as well.
does. You can barely see it coming out. Let me tap it for a second. What did I do with I lost my lid. Sometimes the powder gets stuck, and so.
I saw it come off.
Did you see it come off? Okay. Yeah, so when you just want to test it before, like some of them have a lot more powder coming out, so we'll need to prime that one a little bit more. That one's probably a newer one. All right, so you want to talk a little more about DiamondGlow?
Yeah, so we're moving on to the face, and so what it is doing, so it's exfoliating all the dead skin cells off, and then it's extracting all the pores and impurities in the skin, and then at the same time it is infusing our Skin Medica professional grade pore clarifying serum for the first pass. So it's just an overall excellent treatment. It's really good for acne, especially with this pore clarifying. And the different serums, like Dr. Jacobs had mentioned, vitamin C, ultra hydrating, and the brightening serum are also great too.
So let's talk about why you might want the brightening serum.
So brightening is really good for uneven skin tones and hyperpigmentation. And the more you get these done, which it's recommended to do them monthly, the better results you will see.
And with acne, though, we can do these every 2 weeks.
Right,
Yeah.
right.
So, but if we're doing for brightening or hydrating or any of
Hydrating or-
that, then we
yep.
recommend them monthly.
Monthly, right,
But-
just for maintenance.
Yeah, and for me, like I feel like this is the like an amazing value. You
Yes.
get so much out of it, and your skin just feels amazing. So I feel like this is definitely a necessary treatment for everybody, whether
Right.
you're acne or dry or anything. But like you said, the brightening is excellent for if you have brown spots, hyperpigmentation. Your friend who's going to be doing treatments for melasma.
Yes.
You know, melasma is a bear to
It's tricky,
treat.
yeah.
It's something that you have to, do many, many treatments, but this is a great one because it will help it'll help the melasma, but also hydrate our skin. So our skin is just going to get healthier and look better.
Right.
Your
And
products will work better too.
Yeah, exactly. Your products will work better. Okay, let's talk about vitamin C. So why would you use that one?
So antioxidant and like a rejuvenating serum, so like an anti-aging. So I mean, anybody can benefit from it, but it will infuse the antioxidants into the skin as well.
So perfect. And so we all know we need antioxidants, and that's the beauty of SkinMedica, is that they have more newer antioxidants, more high-powered, that they started off in the HA5, and now that's in the TNSA+. Our new serum will have more high-powered. So the vitamin C and E that you used to hear, which are the antioxidants, the vitamin C and E that you used to hear about, those are kind of old school right now. So there are so many better products out there, and that's the beauty of using a medical-grade skincare line, is because you are constantly moving towards the next best product, next best ingredients, and the ingredients are all tested. So they're proven to work. They're proven to give you the results that you need. So that's why we recommend SkinMedica, because we just feel so comfortable knowing that we're going to see the results that we want. And if you're spending money, we want to make sure that you do have results. So a couple of things with the DiamondGlow. Right now, if you buy 3 DiamondGlows, you get 3 chemical peels for free. Now, these have to be done in the summertime, which is totally fine to do during the summertime. And it's actually good for everybody to get out and get some of their dead skin cells off and get a fresh skin, or get a fresh, healthy skin. So that's an excellent promo that we have right now. The other thing that we could do for acneic patients is just do chemical peels. And we can do chemical peels even on the body, so on the back, on the chest if you have acne, and you can also do DiamondGlow there as well too. So that's what's great, is that it's not just for face treatments, but our chemical peels right now are also, they're half price, and you can buy as many as you want for those, as long as they're done within the summer. So you're probably going to be stuck, doing just 3, which will give you amazing results, because we usually recommend doing, and you can continue with the pore clarifying if you feel like you need to. Yeah, that's totally fine.
I'll do it again.
Yep. Because you're almost through the bottle.
Right.
So that's good. You may as well finish it off.
Got it.
Yay, Mikey. But anyway, the other thing with when you choose to do acne treatments, because we have a lot of kids that come in here, and when I say kids, big kids like this guy, but we do per, how your acne is on the face. And so we give package pricing based upon how bad the acne is. So if we have to do a full Laser Genesis and a full DiamondGlow, then it's going to be full price. But we do some specials when it's just like spot treating, because we know that we want to get this taken care of, and we want to do more treatments, so we try to make the price more reasonable. As far as the DiamondGlow, actually DiamondGlow chemical peel, really any of our services, you can do them in our membership. And the DiamondGlow normally runs $200, but in the membership it's $150 if you do it monthly. So again, a huge savings. You also get Brilliant Distinctions points, which is a coupon basically that you can use on your DiamondGlow. You could use it on a chemical peel. You could use it on product. So all the product that we were talking about with Mikey, the retinol is actually very reasonably priced. I believe the 0.5 is like $78. He would get a $20 coupon from DiamondGlow today, and he actually could use that on his next purchase of retinol, so just take the price down on that too. So there are so many ways to save money, and that's number one, we want results, but number two, we want you to be able to do your treatments, so we try very hard to price things reasonably, and again, do the membership, because the membership is going to be the best price. As far as product goes, our TNS Essential is in membership as well as the HA and our Lytera. The new TNSA Plus will also be in membership, and you'll save 25%. So it's a very big savings, and it gives you a way to save money, get it delivered directly to your door, so the convenience of it all and also the consistency. Because if you just come in and get one bottle of something, chances are you may see a little bit of change, but it's really about the consistency. And if you saw my photos at 2 weeks ago using the TNSA Plus, my skin age was 42 and it dropped down to 38. So we're going to try to take some photos today or tomorrow to see, because I'm at 4 weeks now on the TNSA Plus. So I'm very excited to see how it's improved. And I know 100% it's improved my skin. I feel very confident that we're going to see some nice changes on the before and after photo. So, all right, what else? We're wrapping up. So.
Yeah.
I would say, number one, come in and get a consultation and talk to us about what we can do for your skin, whether you have acne or not. These are amazing treatments for acne, but they're also awesome for just the anti-aging part of the whole thing. The other thing, though, is that you need to know that you have to do a treatment at home, which is product. So you're going to see so much better results when you're doing treatments in-house if you do your treatment at home, which are all your products. And we can help you, really with any budget, we can help you get on the right products to have healthy skin. That's really what our purpose is that we want healthy skin. And obviously we want to protect it. So that's why the products that we recommend that actually do work, that's why we recommend them. And sunscreen, physical sunscreen is what we want. So any closing words, Michael?
I like the laser better.
You like the laser better? Mikey's never been a huge fan of the facial stuff, but I really think that it looks better than when we started.
Absolutely.
You know, he's red because you've been
Vacuuming
messing
his
with it,
skin.
but yeah, but it definitely does look a little bit better. And if he would just come in weekly, maybe we can
more, Mikey.
Maybe we can talk him into Laser Genesis next week, and then we can get him back on for the DiamondGlow.
Yeah.
But it's funny because, he doesn't love this treatment only because he's a boy. The adults, the females, absolutely love it and know that they're getting such amazing results with it. So, okay, any closing words, Carly?
No, just they're both excellent procedures and great combinations, so you'll get even better results with both together. So
Perfect.
Yeah.
So if you have any questions for us, absolutely ask us below, or private message us, or just give us a call at 618-288-9117. Thanks so much.